Plantar fasciitis is one of the most common conditions we see at our practice. But how would you know that the pain you're experiencing is actually due to this condition? Hi, I'm Dara Nichiforova at Dealer Podiatry Associates. Today our Dr. Jeffrey Niemoller is here to tell us all you need to know about this painful condition and how to effectively treat it. Hello, doctor. Please tell us, what exactly is plantar fasciitis?
Plantar fasciitis is one of the most common conditions we see in the foot. And basically what it is inflammation of a structure that's on the bottom of the foot that runs from the heel bone to your toes. And as it becomes inflamed, you develop a great deal of foot pain.
What is the most common symptom?
Most common symptom is pain first thing in the morning or after you get off of your feet. When you step on your foot for the first time, you get a deep, really intense burning pain on the bottom of your foot. It's also common with this condition to experience numbness on the side of the foot due to inflammation of a nerve that runs on the side of the foot. And eventually, as the disease progresses, though, the pain will go from just being from first thing in the morning or when you first get on your foot to being there all the time.
On a scale of 1 to 10, how severe is the pain?
I would say it's probably about an 11.
Oh, wow.
I've had people come into my practice and they relate the pain to being stuck in their foot with a knife or stepping on a nail, stepping on a shark tack. And it becomes to the point where the pain almost becomes unbearable or unlivable. And I've had people come in with this condition and when I tell them what it's all about, they tell me that can't be what it is. I have to have something more serious because the pain is so intense.
I see. So what is the plan of action?
The plan of action is you always want to first start with conservative care. The first thing you want to do is get an x-ray done. You want to confirm that they actually are experiencing plantar fasciitis and not, God forbid, a more severe condition, say like a calcaneal stress fracture or a true fracture of the calcaneus, which is the heel bone of the foot. Once you rule out that there's no other conditions present and you are dealing definitely with plantar fasciitis, you want to first start with a conservative course of action. And the first initial treatments are geared at reducing the inflammation in the plantar fascial ligament. You can first begin with a series of cortisone or steroid injections. You can tape the foot to support the arch to again relax the inflammation in the plantar fascial ligament. You can also prescribe what are called custom-made orthotics to help stabilize the arch. If a period of pain is going on, say 1 month or 2 months, then the next step is to do what's called an Mri exam. And basically what you want to check for is to make sure that there's not, first of all, something that the x-ray may have missed, say like a soft tissue mass or a tear in the plantar fascial ligament. If one of those conditions is found, then you definitely want to move on to the next course of treatment, which would be more of a surgical treatment approach, particularly if you're using conservative treatment options, say like a month or 2 months, and there's no improvement in the pain.
I see. What are the other conditions that plantar fasciitis has similar symptoms with?
Other very similar could be, like I said, a calcaneal stress fracture. Particularly, a lot of times you'll see heel pain in a very young, active population. And say if someone is running or starting a exercise program that involves a lot of pounding on their foot, that can present very similar symptoms to plantar fasciitis. If someone has a true fracture of their heel bone, it can produce very similar symptoms to plantar fasciitis. Also, if they have a soft tissue mass, what's called a plantar fibroma in their plantar fascial band, that can produce very similar symptoms to plantar fasciitis. So there's a lot of conditions that can very closely mimic plantar fasciitis, and you really want to kind of confirm that none of those are going on, particularly if the pain is not responding to your treatments. Most times, simple plantar fasciitis, I would say about 95% of the time, will resolve itself with conservative treatment means. About 5% of the time, it's needed to go on to surgical treatments. And that's why you really want to, if the pain is not responding to what you're doing, you really want to do an MRI to rule out those other conditions.
In what cases would you recommend a surgery?
Particularly if pain is not responding to your conservative treatments. If you do order an MRI and say if you see a soft tissue mass or a plantar fibroma, most times that is going to have to be removed. If you are dealing with say if you're doing conservative treatments and the patient is only experiencing maybe 10% relief, that's really not adequate. You want to be able to offer something to the patients to get them really to 100%, be pain-free. It's particularly in the population group that most frequently develops plantar fasciitis, which is usually a young, active population, and then you would want to move on to more of the surgical treatments.
How invasive is the surgery?
Most of the surgical techniques that have been developed for plantar fasciitis are not that invasive, and they usually offer a fairly quick recovery time. In the past, plantar fasciitis surgery was done with a rather large incision on the heel. You would go in, you would cut the plantar fascia ligament, and that meant time off people's feet. Sometimes they had to be off their foot for 4 to 6 weeks, and particularly, like I said, in the young population, they don't want to deal with that. They don't want to go through that. So the techniques that have been delivered today are you can incise the plantar fascial ligament utilizing a scope, which eliminates the need to make the large incision on the side of the heel. You can use another technique called PRP. You take the person's blood, you isolate the platelets, you re-inject it around the area of the plantar fascia, and that heals the scarring, it heals the damage that's been done to the plantar fascia, and we've been seeing very good luck with that type of regenerative treatment.
What are the risks associated with PRP injections?
It's really minimal because the cells are really taken from your own body. So basically what you're doing is taking your own blood, spinning it down, really isolating the platelets or the healing component of your blood and re-injecting it into the area that is basically damaged or that needs to be healed. So really there's minimal risk of any, and it's been very successful. It's been very successful in getting the area to heal, to allow the normal cells to regenerate. So there really is not any risk really involved with this procedure. One treatment that's also been developed in the past few years is called the 10x technique, which utilizes basically a high stream or high velocity stream of water and a very fine needle which removes all the dead or injured tissue from the plantar fascia ligament to restore it to its normal health.
How big is the incision?
It's actually very small. It's very, very tiny. It's very pinpoint. It's only basically small enough for the needle to be inserted into. So there's no need for stitches. People get back on their feet very quickly. At most, it might entail maybe 1 or 2 days off their foot, not 4 to 6 weeks like what was needed with the traditional plantar fascia surgery. So it's really a very quick recovery time.
I see. So just to understand this better, we perform this 10x procedure,
Yes.
which flushes out the inflammation.
Yes.
What kind of fluid do we use for this purpose?
It's just basically normal saline or normal water, and what it does is it's a high, like it's basically a supersonic stream of water, and it removes all the devitalized tissue, which basically undoes all the damage that people were doing when they were injuring their plantar fascia ligament, and it restores it to a healthy structure. And the thing that's nice about it, because it's such a small incision, it's relatively non-invasive, it doesn't do any harm to the tissues, it's removing anything that was causing the pain to begin with in the first place, and people can get back to their activity level really quickly, and we've seen really outstanding results with it.
What are the risks associated with this?
Well, risks like any other surgery, the primary risk is always infection. The second risk, obviously, is no surgery is 100%, and that's why you really need to exhaust all your conservative options first. Mostly, the risks for this type of surgery are quite small.
Is that actually true that if you create a micro damage to a tissue, this will accelerate the healing process and collagen production?
That is true, especially if you do like sometimes microtrauma to the area. Basically, what the theory is that your immune system will be stimulated. It'll come in and it'll break down. It'll basically allow your own body to heal itself. So that definitely is a valid theory that appears to be one major factor in particularly wound healing and surgical healing, and that definitely is true.
I see. So if patient decided to take the steroid injection route, how often can you do these injections and how many?
Typically, you can do up to 3 injections. I will sometimes go up to do a 4th injection, and what I usually do is I'll do 1 injection the first visit. I will see them back either a week or 2 later, do a 2nd injection. The 2nd injection is really keyed on to how much pain relief they get. If I see somebody, if I do a steroid injection and they come back to me and say, geez, doc, the pain is worse or it did not improve at all, sometimes I'll do the 2nd injection, but usually on the 2nd injection, I'll then send them for the MRI. Typically, the golden rule is 3 injections. And if they really not improving after the 2nd or 3rd injection, that's when you really need to start looking out for something else going on, or something potentially bad going on, or something that might need more aggressive treatments.
Are there any restrictions with the candidate for injection, like diabetes, for example?
There absolutely is. If a patient is diabetic or poorly controlled blood sugars, you really don't want to do a steroid injection, because I've had patients who, unfortunately, one problem with podiatry, sometimes people come in and they give you sometimes a kind of not a whole conclusive background of what's going on with their medical issues. And I remember I had one patient when I was early in my career, and they were an undiagnosed diabetic, and they didn't mention this to me, and their blood sugars, I believe, shot up to 600-700. So definitely, if a patient is diabetic, that is a contraindication to doing the steroid injections, because it definitely can make the blood sugars go out of control. So that's one area where you do have to be very careful with.
I see. So let's say a patient is trying to be very conservative. Surgery is not an option. Steroid injection is not an option.
One technique that's very effective is to make what's called a custom foot orthosis, or an orthotic, that basically stabilizes the arch. It controls the way your foot type is. And a lot of times that will be enough to, just by supporting the arch, relaxing the plantar fascial ligament, it'll be enough to do away with the patient's heel pain. And sometimes you don't have to do any other treatment options. Sometimes you get lucky by just doing that. And a lot of patients, that is what they want. I'm not crazy about getting needles. I know a lot of people feel that way, although it's not that painful to do the injection. But a lot of people do want to stay away from that, and I can't really say I blame them. In addition to the injection, it's always a good idea to combine the therapies, what's called a non-steroidal anti-inflammatory drug. Basically what that does is it reduces the inflammation in the plantar fascia. And here at a practice we use the latest range of drugs that are designed not to cause a great deal of stomach upset, so you can safely take them and not have to worry about the risk of developing a stomach ulcer or excessive acid in your stomach. And it's a very good technique to use with the injection, because it really helps to, or even if you decide not to do the injection, it's a good thing to do because it will help to reduce the excessive inflammation in the plantar fascial ligament.
Thank you, Dr. Niemöller, for this great information. There is no doubt that plantar fasciitis is painful. If you think you may be suffering from this condition, please visit us at Delore Podiatry so you can say hello to our staff and goodbye to plantar fasciitis for good. For Delore Podiatry Associates, I'm Daria Nichiforova. See you next time.